Hello guys, the next commonest workout injury is shoulder strain. Before that, if you haven't subscribed my channel, please subscribe to get our continuous updates. Now, let's go to the topic. The rotator cuff is often involved in shoulder injuries, including impingement syndrome and glenoid labrum tears. Rotator cuff tendinopathy is an overuse injury which is typically caused by training programming errors, excessive weight progression, and improper form. If the rotator cuff is weak, fatigued, or simply not properly engaged, the upward pull of the deltoid will often pinch the supraspinatus against the underside of the acromion. Acromion is the top part of the shoulder blade that meets up with collarbone. This will often result in some swelling and inflammation of the tendon, possibly some swelling and inflammation of the subacromial bursa. Subacromial bursa is the little cushion-like structure between the cuff and acromion. For some lifters, the cuff may eventually begin to fray by this pinch and rub cycle, leading to degenerative tears or partial tears of the cuff. Now, we look about common risk factors of shoulder strain. The barbell overhead press is the main reason for shoulder strain. It can be performed with the bar behind the head. When this form is used, excessive stress is placed on anterior structures like the supraspinatus. Performing behind the neck military presses and other exercises where the arm is abducted and externally rotated also can cause shoulder strain. So be careful while doing this type of workouts. We suggest training the rotator cuff itself to minimize the injury risk. The key is generally to train the rotator cuff with resistance below the level that will elicit too much work from the deltoid and pectoralis muscles. Also, don't forget to work the scapular stabilizers, the trapezius and rhomboids. In the inflammation phase, don't do any pressing motions, upright row or lateral raises. In repair phase, you can begin pressing motions but use underhand grip and low weight. Avoid fly type exercises. In the remodeling phase, don't do any explosive exercises, begin non-pressing motions, gradually transit to pressing motions. Upright row might still be problematic as it places the shoulder in an unnatural, impinged position at the top of the motion. Follow our recommendations and be careful about your workout types that can be helpful for your better outcome from your workouts. If you have any doubts, you can put them in the comment section. We will clear them as much as possible. Thank you.